Hey everyone, it's nice to see your faces. Hey Nikki. It's nice to see your faces, and for those who don't have your cameras on, it's even just nice to see your names as part of this. Thank you up front to Dave Camper, who's going to walk us through the changes, the revisions in the policy. Hey Melissa. I just want to say Nick Snavely just had a baby last night. So everyone congratulate Nick Snavely.
All right, Nick.
His wife had the baby. Sorry to be kind of particular about that, but I think he, right, Nick?
That's a new baby? Is that?
So we're gonna be talking tonight about the changes in the COVID leave policy. We fought really hard and worked in partnership, and we're really proud of the partnership work that we did with MMB and the governor's office over our original COVID leave policy, which was one of the most generous in the country. And the most generous in Minnesota, and we would tout that everywhere we went. But it turns out that had a shelf life, and MMB is revising the policy, and Dave is going to kind of go through all of those revisions and what they mean for us. We wanted to put this webinar on today. The revisions take in effect next week. So this is for us to prepare our members for that. I will say that the policy was supposed to go into effect July 8th, and we pushed back really hard on their time frame, and were able to get it extended and essentially buy our people 2 more weeks of the current COVID leave. The couple of things I want to say about what their reasoning for doing this is, they want to be in line with the federal government guidelines. They're not sure what kind of authority they have outside of the governor's emergency order that's going above and beyond what the federal guidelines are. Now the governor's executive order or emergency order is still in play, but really the central reason for them is budgetary. The employer has spent about $36 million on the COVID leave policy so far, and they think they can save about $10 million by doing these revisions. And that they told us if they weren't in the budgetary crisis that they're in right now, that they wouldn't be looking at changing it. They would just continue with the emergency order. So that's where it is. I don't know, Leah, Mike, Dave, you want me to say anything more before handing it over to Dave?
And new student orientation all day today and again tonight.
Okay. So if are there questions of me before we hand it over to Dave to talk us through what the changes are going to be? All right, over to you, Dave.
Thanks, Lena. I'm not trying to compete with Nick Snavely here. I don't have a baby to show you, but I do have these adorable little kittens, Laverne and Shirley, who are about 3 months old now, and so they're pretty cute. I got a lot to go through, and so I'm going to try to go through it at a brisk but not too crazy pace. Please use the chat for questions, and we will do Q&A at the end, so hopefully I can get through your questions as we're going. I want to stress up front that this is an incredibly complicated new change to the policy, And even though I'm coming in as prepared as I can, I think there's a decent chance I'm going to make an error somewhere along the way, not intentionally. So do keep an eye on the MAPE website and other sources as we continue to update this. But let me begin. The overview here is that this is a cut in benefits. They're taking one policy, the COVID leave policy, and creating two policies. The eligibility criteria for who gets it and who doesn't get it is largely the same. In fact, I don't really know if there's any substantive differences, with one significant exception I'll get to in a minute related to facility closure. And the main cuts are in the amount of time available for COVID leave and the amount you get paid. Real quick, the current COVID leave is COVID type 1 and COVID type 2. COVID type 1 covers almost all the situations we deal with. People who are sick, people who are caregiving for their kids under 12, people who are caring for family members with COVID, people who cannot work because their facility is closed and telework is not a possibility for them. Right now that's full pay, and there's no maximum limit to it up to your normal work hours. People who are priority 1 and priority 2 do need to get special approval, and we've had to work some of those cases over time. Medical documentation has been required for the medical stuff. And then there's been COVID type 2 leave, which is for school-age kids over 12. And that has been a reduced pay, up 2/3 pay, only up to $200 a day, and up to only the 12 weeks, the FMLA limit. That's what we have right now. And I'm being really brief on that because I'm going to focus on what's happening next. What's happening next is we're getting two COVID leave policies, 1440 and 1441. The first policy they're calling paid COVID-19 leave, and for the rest of this presentation, I'm going to call that COVID leave. They also created expanded FMLA, or COVID-19 related school/child care, which is HRLR policy 1441. And they're calling that expanded FMLA or EFMLA, and that's what I'll call it for the duration of this presentation, EFMLA, which I will absolutely butcher a few times, and I just trust that you'll know what I'm talking about when I throw a bunch of letters out. Here's the good news. The good news is that we don't have to play this game with wondering if the governor's peacetime emergency declarations can be extended anymore. Starting July 22nd, this policy is good through the end of the year regardless of the peacetime emergency. That's good news, because we've been, every time the emergency is coming up for expiration, we've been wondering, and now we don't have to worry about that. The bad news is everything else. It is
Can you do me a favor?
Yes?
Yeah.
Someone asking me for a favor, or someone talking to someone off stage?
I would recommend that everybody who's not talking to mute themselves. That'd be great.
Can you check how many panels there are on the pool? Dada wants to clamp for every other panel. Can you
Shannon, would you mute yourself there, Shannon? Thank you. All right, so I'm going to move on here. In general, so people are probably going to be asked by their agencies to resubmit their leave request forms. It's not an automatic, but I think we should assume it's going to happen and tell people to prepare for it. None of this that I'm going to discuss is retroactive. Everything starts fresh on the 22nd, brand new. When you're on either COVID leave or EFMLA, you will not get accruals. No sick leave accrual, no vacation accrual. That's the case now too, but we're just clarifying that that's the way it is. For people who are priority 1 and priority 2 employees, as is the case now, you will need to get it authorized. Priority 3 and priority 4 employees will need to fill out the forms, but if you meet the criteria, our understanding is you will get the leave. So those are the general criteria that apply to both the COVID-19 and the EFMLA. So why don't I start with COVID-19 leave? This is a single 80-hour, and prorated for part-time. Let's just treat it as full-time for now. A single 80-hour bank of leave. That everything covered under COVID leave is against a single 80-hour bank, which is supposed to last you through the end of the year. If the leave you are taking also is FMLA covered, it will count against your FMLA balance, but you don't have to have FMLA balance left to use COVID leave. That will be different with EFMLA, which I will get to. So this 80 hours is for everybody regardless of FMLA status. There are 3 things that you can use this COVID leave 80-hour bank for. The first is health leave, and this is the term they use for you yourself, not for others, for you. If you have symptoms of COVID and are seeking a diagnosis, and that's only the actual time spent getting the diagnosis. If you've been told to quarantine by a healthcare provider or by a government order, you will need, in these cases, medical documentation. It's possible that sometimes they won't ask for it, but they have a right to ask for it, and we should assume they will. And in this case, you do get full pay up to a maximum of $511 a day. I do not believe we have any members who make more than $511 a day, so we're probably good there. If you do make more than $511 a day, let me know what your job is so I can apply. This is health leave for the employee. And again, everything here is going to require medical documentation, and it's only specifically for COVID, for seeking a diagnosis, and for specific orders by a healthcare provider to quarantine yourself. One thing to encourage members to do is if they're talking to their doctor, to ask their doctor or other healthcare provider, do I need to quarantine? And ask the doctor to put together a piece of paper that has the word quarantine on it. That will make life easier for all of us in helping people if we can. The second kind of COVID leave is what's called care leave. And this is effectively everyone who you're caring for who's not you. And the phrase that's in the policy that's important is an individual who depends on the employee to care for them. Now, what's nice about this is that's actually broader than the definition in our contract of what you can use sick leave for. This is anybody who depends on the employee to care for them. And that would include, for example, domestic partners, but also potentially anyone who you have that kind of relationship with. And it would have to be a reasonable expectation of care. You can't suddenly discover tomorrow that your next door neighbor is someone you're supposed to care for. You have to have already established that relationship. Now, when you read the COVID leave policy, it's going to, the sentence that I'm addressing in this section here is going to read funny because it looks for a moment like if the person is, and I'm quoting here again, is particularly vulnerable to COVID-19, you can use care leave for them on your own judgment. That's not what the policy says. It's a long subordinate clause with a lot of commas and semicolons. What it actually means is a healthcare provider has to certify that the person has COVID, is quarantined, may have COVID, or is particularly vulnerable to COVID. So again, you need a healthcare provider to put that on a piece of paper for you. And so this is, I'll talk about this more in a minute, but this is not a situation where you're allowed to substitute your own judgment over that of a healthcare provider, even though we really wish that were the case. And so just want to make that clear. It is fairly broad language, but it all requires healthcare provider certification. In this case, the pay is limited. It is 2/3 of a day's pay up to $200 a day. You are allowed to supplement your pay with vacation or comp, or if you are using something that qualifies for sick leave, to make up your full pay. And I look forward to all the challenges we're going to get with payroll dealing with 2/3 and 1/3 and hours of leave. Is going to be 13.3333 hours of sick. It's going to be fun. And we're going to have to encourage our members to be really careful about documenting because I really worry about how the state's going to get this 1/3 and how they're going to mess up the amount. So 2/3 pay up $200 a day. You can supplement it with vacation, or if you're eligible to use sick leave to make yourself up to full pay. This is care leave for others. The third case, and understand we're going to cover the same thing in EFMLA in just a second. It's extremely confusing. School and daycare closure. The important phrase for school and daycare closure is that there is no other suitable person available to care for the child. No other suitable person available. We have dealt with situations where both our member and their spouse are both working from home, and they say, well, theoretically, I suppose my spouse could, but they're supposed to work too. We've generally been able to let those go, but the employee is going to have to certify, put it on the form, that there is no other suitable person available. If the child is older than 14, they will need to certify that special circumstances exist if they're going to provide care for them during daylight hours. The presumption is that a child older than 14 can free range without supervision during daylight hours. The pay, again, is 2/3 pay up to $200 a day. Once again, you can supplement your pay with vacation or sick as applicable to make up full pay. At this point, Minnesota still has as a rule that you are allowed to mix childcare and telework, and that it's understood that teleworking can include a certain amount of time devoted to childcare without having to ask for specific COVID leave. Some states, I've gotten emails from some of you on this, some states are rolling this back. I think North Carolina did it. I think Florida did it. You might know something about the political alignment of those states that might tell us why that's the case, but that's not what we're talking about today. But as of right now, people still are able to mix childcare and telework. And we would encourage people to do that as much as possible rather than put in for this school daycare closure leave, because it is only an 80-hour bank. But after that 80 hours, EFMLA kicks in. And I'm going to get to EFMLA in just a second. But first I want to mention the one thing that's missing from this COVID leave policy that's in the current policy, and that is facility closure. For example, if you are an employee of the zoo and you work in guest relations, so the only time you cannot telework guest relations when there's no guests to relate with if the zoo is closed. Right now, that qualifies for COVID leave. That is completely absent from the new policy. Now, it is possible that that's an oversight, but I don't believe so. And so we're almost certainly going to have to deal with that situation. People who cannot telework because it is not an option for the kind of work they do, but who are not allowed to physically go to work because their facility is closed. This will become a bigger problem if/when we get a second wave and more things close. It will also particularly affect our Ask Me colleagues, many of whom do physical work that can only be done at a work site. If they're prohibited from going to work, this COVID leave policy currently does not cover them. Be sure to address those issues as fast as you can with us.
Hi, Bud.
So the other policy is EFMLA. It's a second policy. It is separate from COVID-19 leave, but it is a separate policy. It's the same eligibility as school daycare closure on the other thing. No other suitable person available to care for you. It is 12 weeks of leave, but the first 2 weeks are unpaid. It's sort of assumed that it's going to dovetail with the 80-hour bank in the previous policy. I hope that makes sense, because frankly, it's kind of confusing. But the idea is it's supposed to use your first 80 hours of COVID-19 leave, and then this leave kicks in for the next 10 weeks. However, it only kicks in until you run out of FMLA. If you are using FMLA leave for some other purpose, and you have run out of your 480 hours of FMLA, you have also run out of the ability to use this leave. I want to say that again because this is important, and it will be something that affects some of our members. If a member is using Family and Medical Leave Act time for something else, like they have recurring medical appointments for themselves or a family member that they use FMLA for, if they have major surgery and they're out for 3 weeks and they're using FMLA for that, they get 480 hours of FMLA leave. Once that time is out, they don't have any more for EFMLA. And if they use EFMLA time up to 480 hours, then they run out of FMLA for anything else they might use it for, like having surgery or anything unrelated to COVID. This is not particularly cool, and it is not an ideal situation. And I would note that it's not required by the federal law. The federal law is silent on whether or not this all has to be related to FMLA. It's certainly clearly the understanding of the law that that's how likely it will be used, but it's not mandated. But the state has decided that this is going to be tied to FMLA. The pay for this is the same as the pay for school daycare closure under COVID-19 leave, 2/3 pay up to $200 a day. You may supplement pay with vacations and make up the full pay, or vacation or comp time. to make up the full pay. Now, in these two policies, there's a huge gap. There's a huge place where a perfectly reasonable human being will believe it's not safe for them to return to work, but that there's no medical documentation to back them up. The examples I put on here, let's say they live with a family member who has a compromised immune system. They or a spouse or someone who's living in the house is pregnant, or they provide care for elderly parents who are, say, lifetime smokers and have very bad lungs. There's lots of members who are in this situation who very reasonably and very understandably are of the view that I don't think it's safe for me to go to work. I think there's a risk I could become exposed to COVID, and that could hurt me or my family members, and I don't want to go. And yet, most of that is not currently covered under the COVID policy. It isn't covered now, but it's also not going to be covered going forward. And we're going to get members who are going to bring this to us. And I want to stress that those members are entirely reasonable and understandable, and I'm highly sympathetic as the spouse of someone who has compromised lungs from a previous illness, that someone being exposed to COVID, there's extra dangerous there. And I should just note here, just not to say much point, that I'm very grateful that MAPE has been a fantastic employer in this regard, to COVID, and thank all of you for supporting good employment practices by MAPE as an employee of MAPE. Here's our advice, and it's what the advice I think we have to give to people, whether we like it or not, when they're in this situation. First, we want to encourage them, try to find a way to get medical documentation. If you can get a healthcare provider to say this person needs to stay home, that's like the gold standard here. We're going to get a lot of good out of that. So do their best to get it. The next step is to work with the immediate supervisor and HR as much as possible and as friendly as possible, as early as possible. It is never too early to contact the supervisor and say, I think I'm going to need COVID leave, or I'm going to ask for COVID leave, and I want to talk to you about the situation because I don't know if it fully qualifies, but I'd like it to. Or what I'd like to be able to do is continue to telework even though you're telling us all we're supposed to go back. Because of my particular circumstances, I'd really like to be able to telework. Now, I didn't put on a slide here because, frankly, it's getting awfully complicated. But another way that medical documentation might work here is through the Americans with Disabilities Act, where telework could be considered a reasonable accommodation. And I can perhaps speak to that a bit more during the question and answer if people want. But the one thing I want to stress out of this, especially the stewards who are here, we can't advise an employee to abandon their job. Even if it feels like the right thing for us to do, it's not something MAPE can officially do to someone. There are going to be people, I fear, and maybe I hope to be wrong, I pray that I'm wrong, who are going to say, look, if I'm told I have to go to work and expose myself to COVID, I'm just going to not show up to work. And if they want to call me AWOL, then they're going to call me AWOL and let the consequences be danged. I would say as much as possible, we want to discourage that because we don't want people to get in trouble, because job abandonment is a very difficult thing to defend members against, and we don't want to be in a place to do that. But we're going to have members who are in a tough spot here, and I'm sorry about that. It's not my fault, but I'm still sorry about it. It really sucks. I've already talked to several of you, some of you on this call, who've explained to me situations that, again, a perfectly reasonable person would say, you shouldn't be exposing yourself to possible COVID right now, but you might have to when you're ordered to return back to work. So again, medical documentation is the gold standard. Otherwise, work with the supervisor and HR to try to continue to telework or find alternative arrangements to avoid yourself with exposure. And as always, encourage people to talk to stewards, encourage stewards to contact business agents if we need help. We'll do everything we can to help you. That is, and I know that I've seen the chat had a ton of questions, but before we get to the questions, I'm going to pass it over to my colleague, Mike Amos, who's going to talk about the process for handling issues related to the new COVID-19 leave in EFMLA. And because we're in the same room, I have to turn my volume off, and he's going to turn his volume on. So just give us half a second there for this to happen, and then we'll get going. All right, my volume off.
Okay, so for those of you that I haven't met, I'm Mike Asmus. I'm the new Director of Member Engagement, Development, and Organizing. I know a handful of you from before. I see Melissa waving. I used to work with Melissa. I was a business agent with MAPE about 4 years ago. So the process that we're going to use is that Steward should help. The first step is Steward should help folks where possible. Some people are just going to need help understanding exactly what the policy is and walking through it. Second step is forwarding issues that stewards can't resolve to the BA that's responsible for working with that agency or that local to help work them out. Because as Dave sort of mentioned at the beginning, some of this is going to be building the plane as it flies and scheming out the answers to the questions. The third thing is on occasion, we'll have things that we're going to have to escalate to MMB. And when that happens, you can work with the business agent who will work with me and or Lena to make sure that we escalate it to MMB as needed. I'm getting a little feedback that there was an echo, so I'm going to briefly go through those 3 points one more time so that folks can hear them. First step of the process is to try and have a steward help where available. The second part is to forward issues to the business agent that works with your local or agency if the steward's not able to resolve it. We anticipate a large influx of questions right out of the gate because this is such a wild departure from what the previous policy was. The third step of the process is if we are not able to get it resolved with the steward and business agent, it'll go to MMB and we'll figure out how to escalate individual cases as needed to the Minnesota Management and Budget. So with that, I'm going to turn it over to Dave for questions, and we'll work out of the chat. Instead of having people try and ask, please add your questions to the chat.
Okay. I'm going to look at the questions here. Let's see here. Let's scroll back to the top and try to get the ones that came early. I meant, yeah, Andrew Perman asked what HRLR stands for in those policies. That's Human Resources and Labor Relations Policies. An adult child, Kathleen asks, caring for an adult child is permitted if there is a special circumstance. And that would usually be something that would be ADA qualifying. And so you would need, again, medical documentation. But yes, caring for an adult child, if there is an expectation of care, is something that you can use the COVID-19 care leave for. And again, expectation of care. If there's no, if normally they wouldn't expect you to go, then you can't do it. Now you're going to kind of be on your honor for that. But I encourage people to be on their honor for that. Hold on, where is that question? Sorry, I'm sorry, we're trying to, okay, there's a few more before that, so I'll get to that in a second. Somebody asked here, my doctor wrote a letter strongly recommending me to telework due to a high-risk condition. Does my employer have to allow this since I've been working from home for over 3 months? So have to is a fascinating word there, or a fascinating phrase there. This, to me, falls under the Americans with Disabilities Act. The Americans with Disabilities Act says, I'm really summarizing very quickly here, that if you have a medical condition that prevents you from working under normal circumstances, that the employer has to offer you a reasonable accommodation. If you've been working from home for 3 months, I think we have a reasonable case to make that working from home is a reasonable accommodation for that situation. And so the way you'd want to go about that is putting the request in terms of an ADA request for accommodation. And we've got some stewards on this call, especially I know Ken Rogers on here. He does ADA stuff over at MnDOT. There's a lot of good people. Your business agent can help you on ADA issues. Again, ADA is probably a good way for people to be able to continue to work from home if they have a medical situation that might put them at higher risk of being back at work. They need to have the doctor say, this is what this person needs. But if a doctor is willing to say that, I feel like we have a pretty good chance we're going to pull that up. Is there an expectation that an employee will be looking for alternative child care if their normal school care is not available? Yeah, I think there's an expectation that you should try. I don't know if there's an expectation for how hard you have to try. I think what you should say is you're making a diligent effort. And I think if you are making a diligent effort, then I think that's what it would be. So Tabitha Reese Miller asks, yes, you're getting 2/3 pay, but using hour for hour FMLA time. Yes, Tabitha, you're correct. The 2/3 pay comes out of the federal law that authorized this paid sick time around the country, and it doesn't feel particularly fair. I can completely understand that, but it is what the law is, and they've got a right to do it. And someone did ask, I don't know if there's a question on this later, well, could we apply for unemployment for that remaining 1/3? And the answer is no, you cannot, because you're not being denied an opportunity to work. Even if you're not getting full pay, you're not being denied an opportunity to work. This is maybe a useful time to remind you that that workers who are not represented by a union very often get these kind of situations where the employer will say, yeah, you can have time off to be sick, but you're only going to get paid 1/3 pay or half-time pay or no pay at all. And that's why this benefit looks so cheap compared to us, because frankly, we have a good union contract that a lot of leave issues. Is there a sense when agencies will call folks back to work instead of teleworking? So what we think we've encouraged in other fora, but what we'll encourage people here to do is to use your agency's meet and confer team to talk with the agency about what the reopening plans are. Agencies, if they're creating reopening plans, should be making those available to you. You certainly should ask for them. Most agencies have some kind of incident command structure in place, and figuring out who that incident commander is and connecting with them for reopening plans is a good thing to do. But meet and confer by agency is the easiest way to get information. And we're very eager and happy to help you do that if you want some help working so on your particular work site. Question why? So as I said earlier, the 2/3 pay issue. Someone asks why not full pay. This is what the federal law says. The federal law says they have to pay 2/3 pay. So what they're doing, if I can slightly editorialize, is they're doing the bare minimum the law requires them to do. In this case, with this new COVID leave policy, is except for the 80-hour bank, which is, well, even that is really the bare minimum they're required to do, and that's the issue. Is there a form to fill out to request continuation of telework in conjunction with a letter from a medical provider? I suspect there will be such forms. I suspect there might be combination forms. I don't know if we're going to get universal forms across all the agencies, or if we might have, if they might come up with something agency by agency. You'll have to ask. And again, you're probably going to be asked to resubmit a lot of the forms that you've submitted. And so just take it as you go. Ask your agency as early as possible what they're going to do. Try to get on top of it. Make sure as stewards and leaders that you're advising your members. Do the best you can on that. But exactly how the forms are going to play out, we don't know. And this maybe leads me to real quick say, folks, this is going to be crazy when it happens. There's going to be all kinds of problems. Just like if those of you remember the beginning of COVID leave, we spent about 3 weeks running all around trying to sort out individual problems and put out individual fires. We're going to have to do that again. There's just no way around it. And so we ask you all to help us out by keeping us informed and help keeping each other informed, and work with your fellow stewards and your meet and confer teams and your local leadership to get on top of this. Cassie asks, did they remove the ability to care for a non-related roommate up to 80 hours? No, they did not, Cassie. The phraseology, again, is that the person has a reasonable expectation of care from you. Let me find the phrasing again. Caring for an individual who depends on the employee to care for them. So if you have the kind of relationship with a roommate where you depend on each other to care, then you're still covered under this. Can a person change their leave status when school starts if students are homeschooling? Yes, you can ask for a different change in COVID leave day by day if you'd like to. I really discourage that because that sounds complicated. But yes, you absolutely can change things. And I think there's still a chance we might see this policy change if somehow a miracle happens and the schools all open back up or whatever. I'm not going to count chickens on that. yeah, if the school year, when the school year starts, you may need to reevaluate your situation. Nick Snavely, who really should be focusing on better things right now, Nick Snavely, because you heard the other states have gone back to their original COVID leave policies. You know, MAPE and all the other unions are pushing, I think, as hard as we can in all of this. And if Mike, do you want to jump in and say anything about that, about what efforts we might be making to get the state to? I'll mute my mic and let you talk.
Yeah, we're having conversations with MMB and advocating there as voraciously as possible. I'm not sure which states in particular you're referencing, Nick. So if you want to shoot me an email offline, I'll throw my email in the chat here again. And congratulations.
Okay. Someone asks about the 2/3 pay supplementing with vacation. Yeah, this is complicated. And it's been used already with the COVID type 2 leave, but that's not a very common one. So effectively what they're saying is, let's say you're taking COVID leave and you get the 2/3 pay. You could get yourself up to full salary by taking 1/3 of your time as vacation. Now, an 80-hour pay period, what's 1/3 of an 80-hour pay period? There's math there and there's decimal points, and at some point they're going to have to round up or down a decimal point, and I don't know exactly where that's going to happen. But what you would do is you would take vacation time equal to 1/3 of an 80-hour pay period, or whatever the appropriate time frame was, to allow you to get up to full pay. And that sounds complicated because it is, and I wish I had a better option for you, but that's what it is. And it's just, again, this is going to create a lot of confusion in our members. And we're going to have to deal with it situation by situation. If my child gets COVID, then I get COVID. I can only use one 80-hour leave thing. That's exactly right, Teresa. This is exactly one of the challenges here. I have friends who got COVID and were out for 6 weeks. Right? They were sick as a dog for 6 weeks. Only 2 weeks of that's going to be COVID leave. And if their kid gets sick after that, there's no COVID leave available to them. What the state will say is you can use your already existing sick leave. You can use FMLA, which is unpaid and supplemented, but that's all they're going to do. And so there are absolutely going to be people who get sick with COVID who will not be covered all the way through with COVID leave. And that's not cool, but it is, in fact, how it's going to be. Angie Perman asks a question. I emailed about this question to your institution just the other day, Angie. About whether or not reporting COVID-19 is required or optional. And my answer is I don't know the right answer yet for that, and I want to duck the question for now. What we certainly would say as MAPE is that we strongly encourage all of our members to report if they've gotten COVID-19. Can you mix telework with EFMLA? Yes, you can. Yes, you can. You can mix telework with EFMLA. We have a lot of people right now who are mixing telework with school, daycare, COVID leave. You know, they're working for 6 hours a day, doing 2 hours of childcare or something. Can you discuss further the first responder definitions exception to EFMLA? And I don't know if I can, basically. I don't know if I can discuss the first responder exceptions. You know what? I'm not entirely sure I can give you a fully clear answer on this. If you shoot me an email, I'll try to answer you. Could MAPE put together an example template letter for requesting continuation of telework? I think we created one of those already. If not, yeah, if we didn't, we will. If people are only taking a few hours a week of COVID leave, is it still 2/3 pay? Yep, that would still be the case. Even 1 hour a pay period of COVID leave would be that 1 hour would be paid at 2/3. And that's how it is. If you get sick and have to be out more than a week, can you apply to short-term disability? So short-term disability is an insurance policy that you have as an individual with, I think, the Hartford's the company. And so what I'd advise everyone to do is read your policy closely. What the policy, broadly speaking, says is you have to have been out for a medically qualifying reason for, I think it's 3 weeks, before you qualify for short-term disability. If you're out sick with COVID and can't go to work, that feels to me like that would fall under your short-term disability policy. And so I think you would be able to apply for short-term disability policy there. As other people have experienced this, that you can, in theory, double dip your short-term disability with sick leave because they are separate and they're not dependent upon each other. Kay thinks it might be 5 days that you qualify for. I honestly don't remember. You have to read the policy to be sure, and I'm not an expert. So that's that answer. Sally Wakefield asked, the 12 weeks total is over a longer period if only part-time. Yes. Yes, Sally, it is hours rather than weeks, really. In certain circumstances, you need approval to use it part-time, but in our experience, it's been readily granted on an interim basis or intermittent basis, and we've not had huge problems with that, fingers crossed, knock on wood. And so we think we should be able to do that.
Oh my God.
Yeah, I'm going to hand it back to Mike for a politics question here.
I can actually take that one, Dave. So hey, this is I'm Leah Solo. I'm the Political Affairs and Communications Director. As far as contacting representatives and senators, I would say with this policy right now, it's they did it this way because of federal conformity. So the people that wrote these laws that we're conforming with are really your U.S. Reps and senators. So we're really at the federal level now. So kind of if we have complaints about how this is, how these laws are structured, it's mostly about going to the federal folks. I would say as far as the state representatives and senators, they have not had much of a say in this, and so that would be maybe a little bit more of a complicated conversation because they would have a say in this if we were to bargain something more generous with MMB, and then the state would have, or the state reps and senators would have to approve it as they have to approve anything with our contract. So that's kind of where it would be. It's a little complicated, and so, but I think if there is, if there is a groundswell of concern that we want to escalate, I think that's kind of a conversation to be had a little bit down the road. Is that helpful, Ted? Okay, thank you.
There's a question here about hours versus weeks, and let me just try to address this question about hours versus weeks. So everything in the policy is formally hours. So the COVID leave bank is not 2 weeks of COVID leave; it's 80 hours of COVID leave. The EFMLA is not 10 weeks, or 2 weeks unpaid and 10 weeks paid. It's 400 hours paid and 80 hours unpaid. But it's based on the assumption of full-time use. So if you're using it only part-time, then you just got to count it by hours rather than by weeks. I hope that came out clear. It came out clear in my head. So is anything preventing a member who qualifies from FMLA and lots of sick leave from using? Yes, so Maureen Dunaway's question is a good one. If you prefer to use sick leave or vacation leave rather than ask for COVID leave, the state will be more than happy to let you do that. And you have a more or less unlimited right to use sick leave for the purposes allowed in our contract, which includes being sick or caring for the family members listed in the contract who are sick. And if you would rather do that to keep your full accruals and to keep your full pay, you absolutely can. That's an individual choice. And some of you, I know, are sitting on huge amounts of sick leave, and so that might be, well, FMLA usage, Tabitha's asking, you're required to use FMLA for a qualifying event. And yes, it's true that if you are taking sick leave for an FMLA qualifying event, it will count against your FMLA bank, but you could still be using sick leave to keep full accruals, which I think was what Maureen's question was. You could still be using sick leave to keep full of accruals. So if someone has a partner working from home, they don't qualify even though they're working too. No, Barb, I don't think it's as simple as that. If you have a partner who's working from home and they are unable to provide care for a child, and therefore you are needed, that's what you have to say to your employer. I'm the only suitable person available to care for the child. We have had a few occasions where the employer has pushed back and said, are you sure you're the only person who's available to do it? If the employee says yes, and if they genuinely believe it to be yes, they should say so. That being said, we encourage folks to try and work this out with their other home occupants around childcare to do the best they can. Do we continue to lose accruals for sick leave and vacation under the new policy if we took COVID leave? Yes, that's still the case. It is the case now. It will still be the case. And I think that's the last one I see. So back to Mike.
Okay, so that concludes our presentation for today. It is a diminished benefit from what we had previously. We know that folks are going to have a lot of questions as they come up. The one thing I want to remind folks is the first step is working with folks, stewards where possible. We know that a lot of those are going to quickly, particularly early on, have to get escalated to your business agent, and then we'll have to take, I'm sure, a myriad of them to MMD as the third step as we move forward. I'll put my email and cell phone in the chat again so that everybody has it, and we'll update the website as we go along and learn more and work out a number of the kinks. And I made a note about getting the example letter of telework if we don't already have it up there. So again, thank you, everybody. If you feel like you've got a question that you didn't ask here, feel free to follow up with me or with your individual business agent. So with that, have a good night.